So hello, everyone. Thank you for joining us at the Canadian Liver Foundation and University Health Network Ajmera Transplant Centre for our patient education webinar series. My name is Anisha Beach, and I will be the moderator and host for this webinar. I would like to start by acknowledging that the Canadian Liver Foundation's national office in Markham, Ontario is located on the traditional territories of the Anishinaabe, Haudenosaunee, Mississauga, and Mississaugas of the First Credit Nations. We acknowledge and extend our gratitude and respect to all First Nations, Inuit, and Métis people for their valuable contributions. Non-Indigenous people have an important role as we work towards reconciliation, and the more we take action and speak up about solidarity with Indigenous peoples, the more we can create lasting change for future generations. The Ajmera Transplant Centre and Centre for Living Organ Donation at UHN are located in Toronto, traditional territory of the Mississaugas of the Credit, Anishinaabe, Chippewa, Haudenosaunee, and Wendat peoples, and now home to many diverse First Nations, Inuit, and Métis people. Toronto is covered by Treaty 13, signed with Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. In this session, our speakers will be discussing nutrition, gut health, and liver health. We are joined today by our speakers, Dr. Katherine Schwenger from the University Health Network in Toronto, and our community advocate, Maria Mai. As for our agenda, we will have two speakers complete their talks prior to moving on to a question and answer portion. For those of you who may not be familiar with the Canadian Liver Foundation, the CLF was established in 1969 and was the first organization in the world created to help people with liver disease. The CLF is committed to promoting liver health and improving prevention, diagnosis, and treatment of liver disease through our four core pillars: research, education, patient support, and advocacy. The Centre for Living Organ Donation was established by the Ajmera Transplant Centre in 2018. Its mission is to improve access to living liver and living kidney donation and transplantation. The Ajmera Transplant Centre is Canada's largest transplant centre, and the University Health Network's Toronto General Hospital is one of the most well-renowned hospitals in the world. At this time, I would like to welcome our first speaker, Dr. Katherine Schwenger. Dr. Schwenger is a scientific associate at Toronto General Hospital, and she has completed her dietetic training at the University of Guelph and Ph.D. at the University of Toronto. Dr. Schwenger's research focus is on nutrition and gastrointestinal disorders. She is conducting several studies on patients requiring nutrition support, people with non-alcoholic fatty liver disease, and patients with obesity undergoing bariatric surgery. Dr. Schwenger, over to you.
Thank you very much for that introduction. And I would like to just dive into my talk, which is focusing on gut health, nutrition, and liver disease. So just a brief outline of what I'll be covering today is that I'll be going over generally the background of liver disease and gut microbiome, and discussing what the gut microbiome is, how it's formed, and dysbiosis or unbalanced microbiome, and how that relates to liver disease. And really going into that relationship between liver disease and gut microbiome. And then I'm going to really focus on how we can modify the microbiome, and specifically focusing on the Mediterranean diet. So as we know, liver diseases form a major worldwide burden. Recently, disturbances in the gut microbiome, known as dysbiosis or an unbalanced microbiome, have been associated with a wide range of liver disorders. Emerging evidence supports the bidirectional relationship between the gut microbiome and the liver, which results from the liver receiving about 75% of its blood supply from the intestines via the portal vein, and the liver releasing bile acids into the biliary tract. As a result, the intestinal microbiome may contribute to liver disease through several mechanisms that can be influenced by the gut microbiome composition, the microbiome metabolism of bile acids, and things such as diet, environmental factors, and genetics, with bacteria and bacteria products such as metabolites translocating or going through the intestinal wall and intestinal barrier into the portal system, which then can get to the liver. So what is the microbiome? So living inside every person, there are trillions of microorganisms. The human gut microbiome is incredibly complex, and it comprises of 500 to 1,000 species and several million genes. The gut microbiome affects human health, sustenance, and well-being. The gut microbiome uses foods that we consume and can release harmful or beneficial metabolites and can regulate our immune system. So what are metabolites? Metabolites are intermediate or end products of metabolism, and the human microbiome modulate metabolites. So some examples of this, which we'll talk a little bit later about, are short chain fatty acids such as butyrate, acetate, and propionate. So the gastrointestinal tract is home to trillions of microorganisms, including bacteria, fungi, yeasts, parasites, and viruses. All of these maintain a commensal, symbiotic, and sometimes pathogenic relationship with humans. These communities of microorganisms outnumber the cells in the body 10 to 1 and can weigh up to 2 kilograms, so there's a lot of them. In general, they are recognized to perform a number of functions in human health, such as aid in intestinal motility, interact with the immune system, participate in digestion and nutrient production, and can play a role in metabolism and homeostasis. You can see that here are listed the gut microbiome that are the most abundant, including firmicutes, actinobacteria, proteinobacteria, and bacteroidetes. So what influences the gut microbiome? The characteristics of the gut microbiome are influenced by a number of factors, starting at birth with the type of delivery, whether it be C-section or parvaginum, as well as early feeding patterns, such as breastfeeding versus formula. Human genetics also play a role, as does geographical location of where you're born. And stress across the lifespan may be viewed as a threat to the diversity of the gut microbiome. A westernized diet is also thought to compromise the integrity of the gut microbiome. However, exercise might promote the stability of a healthy microbiome. We've also seen that aging is associated with a decrease in diversity, and there are many diseases, such as liver disease, that might also be related to this narrowing or reduction in the diversity of the microbiome. So overall, what we're seeing is that the microbiome is actually really a double-edged sword. The gut microbiome can contribute to both health and disease. It can be beneficial, such as inhibit the pathogen growth, convert prodrugs to active drugs, degrade polysaccharides of plant origins, produce folate and vitamin K, produce beneficial short-chain fatty acids, stimulate and modulate the immune system, regulate body fat storage, maintain that gut barrier function, and stimulate gut motility. But the gut bacteria can also be harmful and contribute to inflammation, sepsis, bowel motility problems, liver damage, and can produce carcinogens. Recently, disturbances in the gut microbiome called dysbiosis have been associated with multiple diseases, including the liver. So I've spoken about dysbiosis. So to make it more clear, microbiome dysbiosis is really an imbalance of the microbial species due to mainly a reduction in the diversity within certain bodily microbiomes. Beneficial bacteria are usually minimized, where other harmful bacteria increase in number. Dysbiosis, or this unbalanced microbiome, can be caused by many factors, such as genetic background, health status, such as infections and inflammation, lifestyle habits, or more importantly, environmental factors such as diet, so diets high in sugar and low in fiber, or xenobiotics such as antibiotics, drugs, and food additives, as well as hygiene. Changes in the microbiome have been suspected in playing a role in liver disease through this gut-liver axis. So going back to what I previously mentioned, that 75% of the liver's blood supply comes from the intestine, from the portal vein. In a dysbiotic or unbalanced microbiome state, we actually see an increase in pathogens or dangerous or ungood bacteria translocating across the gut barrier, which increases intestinal inflammation and causes this sort of leaky gut. This allows for the translocation of potentially harmful metabolites to transfer from the gut into the portal circulation and ends up in the liver, which we see in liver disease. So overall, this is a complex slide, but what I want to show is that many studies have investigated the differences in the gut microbiome between healthy controls and those with liver disease. This image represents a summary of these studies. So the green arrows represent a decrease in what is known to be beneficial bacteria, whereas the red arrows represent an increase in harmful bacteria. There are unique similarities and differences between the types of liver disease, with the evolution of liver disease phenotype likely being driven by this unbalanced gut microbiome or dysbiosis, amplifying the inflammatory state, which leads to fibrosis in the liver and portal hypertension. So just to give you an example, some gut microbiome, such as ruminococci, which you can see here, produces short-chain fatty acids that can reduce colonic inflammation. On the other hand, pathogenic gut microbiome, such as bacteroidetes and enterobacteria, produce substrates such as endotoxins. The immune system recognizes these harmful substrates and peptico and bacterial DNA, leading to the upregulation of inflammatory mediators, such as something called TNF-alpha. This inflammatory cascade has been linked with hepatic encephalopathy and is a promising target to alter disease phenotype. Furthermore, they see these toll-like receptors that are expressed in the liver, Kupffer cells, endothelial cells, stellate cells, and biliary epithelial cells, and hepatocytes. And activation of these cells, which we've seen the bacteria do, can contribute to liver fibrosis. The gut microbiome also contributes to liver disease through several ways, including it produces, as well as some of its components. So, for example, the gut microbiome can use dietary fibers that we consume to make short-chain fatty acids, the most common of these being acetate, propionate, and butyrate. A reduction in these short-chain fatty acids, such as butyrate, decreases the expression of these things called tight junction proteins that are on the intestinal epithelium, which then contributes to a leaky gut, which is linked to liver disease. So what can we do? There's ways that we can modify the gut microbiome in liver disease. And although an unbalanced or dysbiotic gut microbiome is related to liver disease, recent research has focused on how to modify it. There are both gut microbiome therapies and host-directed therapies. Majority of the research so far has investigated the impact of gut microbiome therapies, specifically dietary interventions, prebiotic, probiotic, and symbiotic introductions, and recently fecal microbiome transplant for liver disease. So this is an example of some of the microbiome modification therapies that I'm going to be focusing on. We have prebiotics, probiotics, symbiotics, fecal microbiome transplant, and diet. So prebiotics come from complex carbohydrates and form short-chain fatty acids. They have been found to stimulate the growth of beneficial bacteria and include types such as inulin. Probiotics are living microorganisms that have antimicrobial effects and have been shown to enhance mucosal barrier integrity. There are many different types, with the most common being lactobacillus. Symbiotics are a combination of pre and probiotics and augment and activate and prolong the survival of potentially beneficial probiotics. Fecal microbiota transplants is a new form of introducing a healthy gut microbiome into the human gut. The introduction of healthy microbiome is done through different methods such as colonoscopy, enema, NIP tubes, or oral capsules. And finally, the diet has been shown to be a potential therapy for an unbalanced microbiome. The diet overall is the simplest and most effective approach to modulate the gut microbiome. So these are just a summary of the studies, what studies have found. So research of these therapies in specific liver diseases have been promising. This image provides a summary of key findings from these studies. To date, majority of the studies have been done in individuals with non-alcoholic fatty liver disease. Overall, these therapies are improving liver-related biomarkers and decreasing inflammation, which is contributing to a decrease in hospitalizations and, in some cases, mortality, resulting in an increased quality of life. The proposed mechanism is by increasing beneficial gut microbiome and thus improving gut microbiome diversity and decreases that dysbiosis, or it maintain a more balanced microbiome. To properly determine the best prebiotic, best strain, and amount of probiotic and/or combination for symbiotics based on disease type and stage is an important area that is being looked at, and many studies are underway. Furthermore, studies are underway to better understand fecal microbial transplants and what method of delivery is best, and how often the healthy microbiome needs to be introduced, and if it is a sustainable technique to improve one's microbiome. However, currently one of the best ways to continuously improve your microbiome is through the diet. So as I said, one of the simplest and most effective approaches to modulate the gut microbiome is through the diet. However, the changes of the diet can be seen almost immediately within one day. However, the effects wane within 2 days after withdrawal from the diet. And there is an increasing body of evidence that agrees that the dietary intake influences hepatocellular carcinoma outcomes. So as I said, increasing evidence shows that the gut microbiome composition contributes significantly to the progression of liver fibrosis from chronic inflammation. We know that the underlying mechanisms involve the translocation of microbiome components and metabolites into the liver due to this impaired or leaky gut. More specifically, the gut microbiome components and metabolites, such as endotoxins, as well as other unknown microbial metabolites and toxins, lead to the development of hepatocellular carcinoma. The role of diet-induced changes in gut microbiome composition in liver disease is largely underestimated. For instance, in hepatocellular carcinoma, we see that red meat is positively associated with hepatocellular carcinoma risk, whereas white meat, fruits and vegetables, tea and fiber are inversely related. What's interesting is the Mediterranean diet, though understudied in this population, has been shown to impact the gut microbiome, improve endotoxin and liver inflammation. So overall, the Mediterranean diet can both directly and indirectly through the gut microbiome improve liver disease. The Mediterranean diet, which is rich in plant-based foods, mono and polyunsaturated fatty acids, fiber and phytochemical and vitamin intake, and decreased processed foods, saturated fatty acids, calorie and amino acid intake. This has been shown to directly improve liver disease by increasing immune function and insulin sensitivity, and decreasing oxidative stress, inflammation, and improving comorbidities such as metabolic syndrome, cardiovascular disease, and type 2 diabetes. The Mediterranean diet has also been shown to improve the microbiome. As you can see, it has been shown to improve diversity through increased beneficial microbacteria, which results in this decreased dysbiosis. When we compare the microbiome shifts the Mediterranean diet induces with the microbiome disturbances seen in those with liver disease, we can see that the Mediterranean diet in itself improves a lot of the harmful bacteria seen in those with liver disease. For example, the Mediterranean diet increases beneficial bacteria called fecal bacterium and ruminococcus, which have been found to be decreased in those with PBC, PBS, and NAFLD. We also see that the Mediterranean diet decreases harmful bacteria such as E. coli, which are increased in those with PBC, PSC, NAFLD, cirrhosis, and hepatocellular carcinoma. It is important to note that in the area of microbiome research, there are some discrepancies. For example, the Mediterranean diet increases Osculospira, which is also known to be beneficial for health, which is also seen to be increased in those with hepatocellular carcinoma. However, this is likely due to an increase in specific species associated with this genre. The positive changes in the microbiome also results in positive changes in metabolites. Specifically, the Mediterranean diet increases butyrate, which has been seen to be decreased in those with NAFLD, hepatocellular carcinoma, and PS. And butyrate improves that gut barrier and decreases the translocation of bacteria into the portal vein. These positive impacts of the microbiome and their metabolites further contribute to improved inflammation and oxidative stress. Overall, the Mediterranean diet, both on its own and through positive changes in the microbiome, contribute to improved health. So let's go into what the Mediterranean diet is overall. So overall, research has found, regardless of your liver or health status, the Mediterranean diet provides sustained beneficial changes to the microbiome. The diet is great for individuals with liver disease, their families, and living liver donors, and to be honest, anybody. The Mediterranean diet is characterized by high intake of olive oil, which is rich in polyphenols that act as antioxidants, vegetables, fruits, and nuts, legumes, whole grains, fish, and seafood, as well as low intakes of red meat and processed food. It's also characterized by a reduction in reduced sugars and refined carbohydrates. The Mediterranean diet also incorporates the Mediterranean lifestyle, which includes daily physical activity, the use of local and seasonal products, and overall, the goal is to minimize fast foods. So in this pyramid, you can see at the bottom is what we want to do every day. And as you get to the top, you're going from every day to daily to weekly. Now, and some examples of serving sizes. So for fruits and vegetables, it's about one serving size would be 2 cups of raw leafy salad greens, or 1 cup of cut up vegetables. An example of one serving of fruit would be 1 medium fruit, or 1 cup of cut fruit. Examples of one serving of grain would be 1 slice of bread or 1 small tortilla. An example of a dairy serving would be 1 cup of milk or yogurt. And examples of protein would be protein equivalents would be 1/4 cup cooked beans, peas, or lentils, or 1 egg or 2 egg whites. An example of one serving of fats would be about 1 tablespoon. Now, when we compare it to the North American diet, you can see that there are some things that we can easily switch out in our diet on a daily basis. So some examples of this are drinking water instead of juice and pops, making broth-based soups instead of cream-based soups, using olive oil instead of butter, always selecting the whole grain-based products instead of white breads or pastas, choosing unsalted nuts and seeds over salted or flavored, choosing lower fat dairy options. You want to favor fish and seafood and chicken over red and processed meats. And you want to have dried beans over canned. And overall, meals at home prepared from scratch are healthier than those prepared by restaurants or by other sources. So using a Mediterranean diet as a base, here are some examples of diets from around the world and equivalents that can be switched out. So for example, with grains, these can include couscous, wild rice, quinoa, or buckwheat. Just remember, if there's a whole grain option, it's the best to select that. That are also great include yams, yucca, bamboo shoots, and bok choy. Nuts, seeds, and legumes can also include garbanzo beans, tempeh, and miso. Poultry and eggs include quail and guinea fowl. And dairy can include various milk alternatives. Just remember to always choose the low-fat option if it exists. And some other example of this is queso fresco and ghee. One of the things I also want to bring up are some budget-friendly options for the different areas within the Mediterranean diet. So overall, you can select store brands such as President Choice or Great Value over some of the more global brands. I find that using local farmer markets are also a great place to find local foods at a lower price. Frozen fruit and vegetables are also another budget-friendly option. For fish and seafood, canned and frozen options are often less expensive than fresh. You can also eat meat, especially red meat, less often. And you can also buy in bulk if the option exists and purchase herbs and seeds, as well as herbs and spices, as well as nuts and seeds and legumes from bulk stores such as Bulk Farm. So on top of changing your diet, physical activity is another way you can positively change your microbiome. Overall, research has found that exercise can directly impact your microbiome. As you can see in this image, 30 to 60 minutes of aerobic exercise, such as walking, running, treadmill biking, elliptical, and swimming, alone can increase the diversity of your microbiome and increase the beneficial bacteria. And then when you add resistance training, you can see further positive effects to the microbiome. So overall, what I want to show you in my presentation and explain to you is that by changing your diet and exercise, these are 2 great ways that you can control and improve your microbiome on a daily basis. So overall, changing your diet is a lifestyle change and involves everyone you live, eat with in this journey. I encourage you to discuss your dietary goals with your family, roommates, friends, and work together to plan meals. So on the slide are some great resources you can use to help with meal planning and to help guide you with that discussion about how to incorporate the Mediterranean diet into your lifestyle. And with that, I am done.
Thank you so much for that talk, Katherine. That was fantastic. I would like to now welcome Maria to share her story.
Thank you very much. Good evening, everyone, and thank you to the Canadian Liver Foundation and the UHN Centre for Living Organ Donation Program for inviting me to talk tonight about the patient perspective in gut health, nutrition, and liver disease. Some really excellent information that was just shared by Dr. Schwenger. And tonight, I'll be sharing my own personal journey with rare autoimmune liver disease called primary biliary cholangitis. Katherine did refer to that in some of her slides. It's also referred to as PBC. I'll share my experience from diagnosis to treatment that included needing a liver transplant. So on the left side there, you'll see myself with my donor who donated 60% of her liver to me 2 years ago, and I'm so thankful and grateful. I'll also talk about my lessons learned and some tips for coping with liver disease. All that I'm sharing tonight is from my own unique lived experience, and I wanted to put in a disclaimer that most people living with PBC don't experience the same level of symptoms or even need a transplant or trajectory that I did. We're all unique. However, the commonality of liver disease can be similar, and attention to gut health and nutrition remain a key factor in managing any liver disease. So I'm on this slide. Firstly, wanted to talk to you about PBC, and so that you have some context. So in the middle of this slide, you'll see a timeline. So I was diagnosed with PBC in around 2018, 2019. And it does take a little bit of time. And that was after my liver enzymes were not returning to normal, after I had gallbladder surgery, removing some stones. That was in 2017. Other than that, I didn't experience any real symptoms except, my belly felt a little off a lot of the times, and my appetite seemed to be pretty low. This is important to know as you don't always know what's happening inside you, because symptoms can certainly take several years to see or feel. So it's important to help prioritize gut health and eating well, as we heard in the first part of the webinar, to maintain a healthy gut. There are several types of liver diseases out there, and my example is PBC. It's an autoimmune liver. So over time, the liver can become scarred, and then fibrotic or fibrosis, and then infrequently, it can cause cirrhosis of the liver, which was my case. Causes are really not understood, possibly genetics and environmental factors. A lot of research still has to go into PBC. Usually affects women 35 to 60 years old, and it seems to occur in 1 in 1,000 women. It does affect men, but to a much lesser degree. So my symptoms, so you can see on the left-hand side, the green box, were that were common in the later stage of PBC that showed up, were extreme fatigue. I just couldn't get enough rest. Lots and lots of gastro issues, mostly diarrhea, severe itching, and this is very classic of PBC, of my hands and feet and legs and belly, basically all over. Brain fog, that's also referred to as hepatic encephalopathy. And that's really due to the liver not processing toxins that then affect your mental cognitive ability. I didn't have much of an appetite, taste, or smell, and I would eat a little and feel very full, lost a lot of weight, and in particular muscle mass and strength. I had some nosebleeds that ended up being esophageal and rectal varices, like varicose veins, that I had to get repaired. And then at end stage liver, I had severe ascites, which is an accumulation of fluid in the abdomen. You'll see coming up in a few slides, I'll show you a picture of what that looks like. And it can happen for various reasons. And certainly in this case, it was because my liver at that point was not functioning properly. In 2020 and 2021, so in the height of COVID, it was actually my worst time with the disease. And as you remember, patient-doctor visits were very limited. So here I sat at home doing virtual sessions and, trying to deal with the disease. However, I can say that I had excellent care in terms of physicians being available to me throughout the progression of my disease. And I continued to advocate for myself. So I saw a gastroenterologist initially because of the gut issues I was having that was not normal. And then from there, a hepatologist. And then from there, a hepatologist in the liver clinic, who then provided some clinical support to help me manage the disease around diet. And diet in particular to keep the fluid in the abdomen at bay. So what I did there is I focused on eating what I could, but it had to be sort of nutritious and nourishing, highly dense nutrients, much like Katherine had mentioned. It was high in protein, lean meats like fish and beans, very, very low in sodium, because that's a problem in balancing the fluids in the abdomen, high in vitamins and minerals, and in my case, vitamin D and calcium. In terms of treatment, so moving down to the blue box, knowing that there is no cure for PBC and only management because it's a progressive disease, I ended up requiring a liver transplant as my liver became cirrhotic. So it's now 2 years post-transplant. I took the time to heal and recover from surgery. And then I started restoring my strength, my physical and mental health. And now I feel a sense of renewal and enjoy sharing my story to help others in their own liver disease journey. So this slide is just to show you on the left how my abdomen filled with fluid. And yes, it's pretty shocking, and it was extremely uncomfortable. Even when I was pregnant, I was not this big. I developed a painful hernia over my belly button. You can see that protruding, which I did have repaired pre-transplant. It popped again, and I had it repaired post or during transplant. I would go for weekly drains of my abdomen, and you can see the fluid in the bag on the right, and that's what was draining. I usually had 2 of those bags completely full by the end of the morning. And typically it was about 10 liters that were removed, and that's pretty much the max that they do per person, or at least on me, because they don't really want to completely drain your body and have you go into, distress, which really equated to about 20 pounds coming off of my body. So I often called it relief in a bag. So the middle picture is me post-transplant, 24 hours after surgery, and looking groggy. Next, I wanted to talk about lessons I've learned throughout my journey with liver disease. What I think that's really important to overall wellness, and in particular liver function, is getting proper nutrients. I had lost so much weight and body mass that I was just eating for the sake of eating, but really it wasn't sustaining me. I had no cravings. I didn't feel like anything. I just felt like sleeping, to be honest, and so fatigued. I constantly was searching for information on sources from Google, Facebook, diets to boost my immunity, liver detox strategies, listening to what others had to say. And, everybody likes to give advice on what to eat. the lesson here is that it's important to access credible information from trusted sources, like dietitians, your doctors, your physicians, your health care providers, key organizations that are credible, that deal with gut health and liver disease in particular. So, I would leave it to the professionals to help you. Always follow up with your doctor or specialists. Make sure you keep good records for yourself of your tests, your procedures, and ask lots of questions if you don't understand for clarification. So the more you know about your health, and if you have liver disease, the better you are equipped to manage your health. So I had lots and lots of notes and copies of my records because there were so many physicians involved that I had to retell my story. So I needed to know it well. I tracked and logged all of my hydration, water, and food that I ate in terms of grams of protein and sodium. You can see on the left-hand side there, that was my log. It did get wet over time, and it was helpful when I visited the hepatologist. Actually, this was a requirement that I had to do for 3 months as we were trying to manage my ascites at the liver clinic. And, wouldn't you know it, I snuck in a lobster roll, and it stood out in terms of the number of sodium, of salt. And that was the one thing that I craved during lobster season, and she caught it. I didn't feel motivated to be physically active at all. And I know Katherine talked about the importance of activity. And for me, my belly was very heavy and full of fluid, and I was fatigued. But, having said that, I would certainly recommend that it's important and highly important to keep everything moving and circulating. So this is an example and sample of the kinds of foods I eat now. So my appetite has returned, not what it used to be, but I do try and fill my plate with vegetables and fruit, more vegetables than fruit, personally, and lean proteins. You can see some tuna, there's salmon in one of those. Yep, in sort of towards the middle. Chicken, eggs, scrambled eggs there. I try to make meals that are simple, easy to assemble, and I can layer my plate with color and variety rather than I was making a lot of stews and mixing a lot of foods. But eating this way, where it's almost like a little buffet with some crunch and color on my plate, is more appealing to me now. Oh, and I did want to say that, eating well, recognizing that food in of itself these days is quite expensive. We all know that prices of things have gone up, and the affordability and accessibility, but that there's always options to go to. And Katherine talked about farmers markets and other opportunities for accessing a high quality, nutritious foods. So to close off my section tonight, I'd like to go over a few tips to cope with liver disease based on my own experience. You'll see here on the right is myself on the left, and then to my right is Laura Lee, who's my donor. And that was a picture we had taken at my our 1 year celebration with Lola, who is my liver. And so in terms of coping, monitor your gut wellness. So how are you feeling? How are your stools? Do you have cramps? Is there something different? Eating a well-balanced, nutritious, dense, with vitamins and minerals. Think about all the different colors that you can include in your food. It's much more appealing these days to me. And make sure that you see your doctor regularly. And most importantly, share any new symptoms that you might have. The credible, reliable information for your health is critical. There's so much information out there on food, on gut wellness, on what to do, on cleanses. a lot of fads, but encouraging you to really stick to what is credible, and usually through, health professionals that you'd want to access that information. Speak to others, link to resources and support groups. So since the transplant for me, I have really reached out to different resources and support from a number of programs, and has made me much more aware of my disease, what I can do, and preventing sort of, any further illness, and just keeping myself as healthy as possible. I'm not 100%, but I like to say that I'm a new 100%. And most importantly, overall, taking care of our mental health and well-being, because there is, I feel, a very true connection between mind and body, and gut health and clarity and mind. So mental health is important. So with that, I'd like to thank you for this opportunity, and we'll pass it back to Anisha.
Thank you so much, Maria. That was very moving and very insightful. I would like to welcome both of our speakers now to turn on their cameras, and we will proceed to the question and answer portion of the evening. So we have a couple of questions. The first one for Dr. Schwenger, for Katherine. What about keto? Does that help my liver?
So from a microbiome perspective, and from what I've read, the ketogenic diet, unless you are told that by your clinical team, is actually not great for your gut health. And overall, there are changes that studies have actually seen. So for instance, the ketogenic diet, when we look at the microbiome, we see that there's an actual increase in E. coli. And an increase, so when you take the ketogenic diet, it increases your E. coli, which you also have an increase in E. coli if you have non-alcoholic fatty liver disease, PBC, TSC, and even hepatocellular carcinoma. And they also see that the ketogenic decreases some beneficial bacterium. And that's really because you're eliminating a lot of the complex carbohydrates and grains that we talked about. And that's just a really important part of your diet, especially for gut health and integrity, because when you eat complex carbohydrates and whole grains, it helps feed the beneficial bacteria, such as butyrate, that helps make your gut less leaky at the end of the day. So overall, unless it is recommended to you for a specific medical reason, I do not endorse the ketogenic diet for that reason.
Okay, good to know. Another one actually for you, Katherine. What about diet sodas instead of regular?
That one's a tricky question because there's more research coming out. I always say water first, but if you want to treat yourself, one diet soda over regular would probably be better, just in terms of calories and everything like that. But overall, I would still suggest water flavored with fruits and stuff like that. But yes, for that treat, the diet over non.
Okay, thank you. Question for Maria. How did you handle your fatigue, and how did you build your strength back up after your transplant?
So how I handled my fatigue was not always very well. I slept a lot, to be honest. I tried to make things easier for me to prep when I could. If I had like a burst of energy after a long night of sleep or interrupted sleep, I'd do what I needed to do first and then rest for a couple of hours. So it was like do a little and then sleep a lot and then get myself up. It was a lot of mental work as well to talk to my body to say, get up now. So it is a very challenging thing to do. In terms of building my strength, I started walking as I could, which was not a lot. I started sitting and doing a little bit of stretches and yoga moves in a sitting position and watching some videos to help me with that.
Fantastic. It sounds like there were lots of different strategies that you used to kind of help manage some of those symptoms. Another question for Katherine, work, and how do I know if I need it?
That's tough. I would say overall, in terms of need, if you're eating a well-balanced diet, there's generally not a need to incorporate prebiotics or probiotics. There are specific cases where, if you're on antibiotics for a long period of time, some people would recommend supplementing that with probiotics. Prebiotics work. So it essentially works by feeding good bacteria and helping bacteria grow within the gut. And probiotics work by introducing bacteria that you may or may not have into your gut ecosystem. And I like to think that they work best when they're together too. So prebiotics sort of fibers, and it helps breed the good bacteria. So the probiotic can feed off of the prebiotic. And that's why I think symbiotics are very interesting, because there's more coming out, but in tandem, I think that they're best. And so one is the introduction of the live bacteria, which is the probiotic, and the prebiotic is this fiber that your body can use to break down and create the short chain fatty acids and improve that gut integrity.
Fantastic. Thank you. So having both is kind of helpful, it sounds like. All right. For Maria, what were some of your best strategies for managing all of your symptoms?
I would say that keeping a log and tracking. So I did that for a number of months. And it was because I started to have brain fog. So I was every day sort of ran into each other. So I started just having a log of how I felt. What was I doing? How long did it last? Where did I feel the symptom? Was it, that my bowels were off that day, and how many times? Very descriptive at times, so that, I could go into the physician or the hepatologist when I had my regular appointment and sort of say, over the last time that I've seen you, this is like what I've been experiencing, so that it if someone says to you, what did you eat yesterday? It's hard to remember. What did you eat this morning? So, what were your symptoms 3 weeks ago? Is it a difficult question to answer, especially when you're having bad days? So I would recommend keeping a journal. So I kept a log of my symptoms, when they appeared. Was it like morning, afternoon? I could sort of assess that. And as well, keeping a separate sort of track of all my appointments and tests and procedures results. So I developed sort of like a thick binder of all about me and my liver disease, so that I too could help myself understand how progressive in the disease I was getting.
Definitely. And kind of leading into that, do you recommend any good coping strategies for your mental health?
Yeah, that's a good question. So I had a lot of difficulty pre-transplant, to be quite honest, because I had to go through an acceptance of where I was at, the diagnosis, what it meant. Was I going to be a candidate for transplant? What did that mean? That really was a scary thing for me. But once I got over that, here on the other side, it's magical. Like I would never have thought. I didn't know anybody that had a transplant. I didn't know anybody that had PBC early on. So I initially had thoughts of like really debilitating, what was my quality of life going to be like? I outreached to my work's EFP program, counseling, and just to try and hear my thoughts by talking to somebody, right? Speaking to your own family is different than speaking to, a credible stranger like a counselor. So that was helpful. And then post-transplant, and I should have done this before, but I just wasn't at that stage, is mindfulness activities. So I did do a 12-week program earlier this year that looked at being mindful, at practicing meditation, sleep, sort of sounds, and I guess that's meditation, but I was having some sleep issues, just relaxing and letting my thoughts of illness and how it's impacting me just sort of let go, right? So positive mind is a positive body and outlook.
Thank you so much for sharing that. One last question, I believe, for Katherine. Where do you kind of see liver disease and the microbiome research going? Very interesting.
It's very interesting, and where my research is focused on. I think as we learn more about the gut microbiome and liver relationship, where we're heading is in the direction of how can we modify the gut microbiome to look at, first off, preventative strategies with the gut microbiome, but also how can we slow disease progression with modifying the microbiome. So that's actually where we're looking at next, is seeing if there are potentially specific metabolites that you can introduce that will actually help slow the progression of liver disease and as a potential therapy. But as more we learn about the relationship, the more complex it gets. So that's, I think, a fair bit off, but that's the direction we're headed, is looking at maybe modulating the microbiome for therapeutic options.
Fantastic. Thank you so much. So with that final answer, that concludes our webinar for this evening. I would like to take this time to thank Dr. Katherine Schwenger and Maria Moret for their insight. And I would also like to thank our partners at the UHN Ajmera Transplant Centre and the Center for Living Organ Donation for helping with this webinar. To learn more about liver disease or to find out more about the Canadian Liver Foundation, please visit our website at liver.ca and be sure to follow us on social media for all of the most up-to-date information and liver health tips. For information on transplant and living organ donation, please visit